Corey. Before I introduce Jason, just a couple of updates on the polio front. As everyone knows, World Polio Day is coming up this Saturday. This is a date that Rotary uses as a target for its fundraising and the initiative that it has had for 35 years now to eradicate polio. There are a number of opportunities for you as Rotarians to give. One of them is just to simply make a donation so that we can reach our club's quota. But what we would really like to push, and Ham can talk to us a little bit more later about this, is to join the Polio Plus Society. And with a recurring donation of just $100 a year, you can be a member of the Polio Plus Society. And in addition to that, get credit for your Paul Harris Society. So without further ado, I want to introduce our speaker here today. We are really honored to have one of the truly great journalists who's been telling the story of this disease around our world for many, many years. Jason Beaubien is NPR's Global Health and Development Correspondent, working on the science desk there. He's going to talk to us about his work in covering various diseases and other things ranging from coup attempts to who knows what in his role as an NPR correspondent. One of the things that I was most intrigued with in his bio, and he is, by the way, a native of the state of Maine, is he got his start initially back in the early 2000s when he volunteered to go cover a coup attempt in the Ivory Coast. He continued to spend time in sub-Saharan Africa, and again, a great NPR correspondent, and a real honor to have him speaking to our club here in Park City on the eve of World Polio Day. So without further ado, Jason, take it away. Thanks for joining us.
Thanks a lot, Tom. I appreciate that. I appreciate the opportunity to talk to all of you. I'm going to try to keep it relatively brief to get to questions, because you just never know with an audience like what people really want to hear about. And so I'd like to be giving you that, get you what you really want to know about what I do and the work that I've been doing. But I do have to say, you know, I as someone who's covered efforts to eradicate polio and to a lot of other diseases, Rotary really does stand out as standing behind this effort in a way that you don't see with many other, you don't see that commitment for the long term on other issues. I mean, you know, there are groups that are jumping in on HIV or jumping in on a particular cancer. Rotary has really made its mark on polio. And so I assume you already all know that, but it is known out there that if you're doing something on polio, Rotary is a place to definitely turn. And so it's great to talk with you guys about this this particular effort. I should say that just like everything else, polio eradication efforts have suffered a setback because of the pandemic. I'm sure you all saw that immunization campaigns, vaccination campaigns were suspended in many parts of the world, but including in Afghanistan and Pakistan. And if you actually look at the numbers of cases, we are seeing more wild polio type 1 cases now than we've seen in the last 5 years. And it looks like we're on track to have more than in 2019. The numbers have kind of been going up, but probably even more worrying than that is that they are seeing environmental sampling, basically looking for poliovirus in sewage. That's the main way that that's happening. We're seeing a rise in that in Pakistan. In sort of in terms of raw numbers, the numbers in Afghanistan are up, but Pakistan, they're picking up more out in the community, and it's just a very bad sign. If it's out there, you know, this virus is just kind of amazing about being able to find the kids who are vulnerable, track them down, and cause cases. It really is incredible how different a virus it is from say smallpox. You know, smallpox, it was very easy to find who had it. They, you know, got visible signs of it. Polio is a much wilier enemy, and it can be be moved around by people who are even adults who are infected and end up sort of introducing it into some new area. The other huge issue at the moment in this phase of this eradication effort is the vaccine-derived polio, and that unfortunately also the numbers are not looking good on that, particularly in Africa. We're seeing quite a dramatic rise in type 2 polio cases. I'm sure you guys are familiar with this, but vaccine-derived polio cases are, these cases look almost exactly like polio, and it's got to do with polio that's linked back originally to the oral polio vaccine, but has managed to regain strength out in the wild and is now causing cases. And the numbers are really up on that. And it's both a problem in terms of the actual problem of the disease, and it's a problem on a PR front. It's at a time when numbers are really quite low in terms of the actual number of polio cases out there, to have more cases being caused by these remnant viruses that got their start originally as part of the polio vaccine. It's problematic. There's some new tools that are being rolled out to try to address specifically this problem. You can get it both with type 1 and type 2, but type 2 is much worse. Again, I'm sure you guys all know this. Type 2, the real type 2 was eradicated in what year was it? It was 2015. I think it was 2015. Yeah. Type 3 was eradicated in 2019. So we're down to, in terms of when we're talking about real, original, wild polio. So they've got this new novel OPV, they're calling it, and they're going to use it only on outbreaks of type 2 vaccine-derived outbreaks that they're getting. And they are saying that this seems to be a much more stable vaccine and shouldn't pose the problems that the oral polio, type 2 oral polio strains were causing. I think they're probably right on that. And I think that by sort of attacking these outbreaks with this new tool, I think they're going to be able to get under control. But again, they're usually happening in places that are hard to get to. That's been even harder during this pandemic. So I think, unfortunately, this is going to be a setback. A lot of routine immunization didn't happen over the last however many months, and I think we should probably expect to see a bit of a bump up in polio numbers. That said, I think that things are on track to get the vaccine-derived problem under control. And then you're just down to Afghanistan and Pakistan, and to some degree that becomes a political will issue, and whether the governments are able to control the areas that need to get this vaccine in, or are able to work out negotiations to get in and actually vaccinate kids in places that are not controlled by the central government. It is interesting, like I did a reporting trip to Nigeria, and it went up into Kano, up into areas that are controlled by Boko Haram. That it's just kind of fascinating that the polio has managed to hide out with some of the some really bad actors around the world. Boko Haram in Nigeria, and then in parts of the Afghan-Pakistan border there. And I do think that eventually, I am still optimistic that this can be wiped out. there is though a window when if you sort of let off the gas in the next, I don't know, 4 or 5 years, if people just were like, oh, we got too many other things going on. I'm just amazed at how polio manages to find these little fissures and get in there and reproduce. So I do very much worry that the distraction of the COVID pandemic or just a lack of political will could cause governments to take their foot off the accelerator in terms of trying to wipe this out. What else? Yeah, feel free to jump in if you've got direct questions, either about this or about other reporting that I've worked on. If anyone's got something, just I don't know how you normally work. But
yeah, if anyone has a question they'd like to add in the chat, you guys are welcome to do that as well.
Yeah, actually, I'll pose a question just to get it started.
Sure.
Jason, you touched a little bit on this and some of the challenges with the geopolitical situations in Pakistan and Afghanistan, but how obstructionist have groups like the Taliban and Boko Haram been in the efforts to eradicate this disease?
They've been incredibly disruptive, and they have killed vaccinators. They've intimidated vaccinators. They have at various times put out completely false stories about what the vaccine would do or not do. In Nigeria, there was rumors that this vaccine was an effort to sterilize Muslim children. Things that were completely untrue. The U.S. didn't help issues in Afghanistan and Pakistan by using, it was actually a hepatitis vaccination campaign to help track down where bin Laden was hiding out, but they staged what actually was, they actually did go in and vaccinate kids, but they used it to get blood from 2 children that were in the compound where Osama bin Laden was, and they were trying to confirm whether or not that's where he was. And they had DNA samples somehow, I don't know, linked to him. And they managed to get this syringe, which they used to vaccinate a couple of the kids in there, and saw that they were genetically related to him. And that was another piece of confirmation that he was in that compound. Well, that story has just undermined confidence in vaccine campaigns, unfortunately, in that region, which was already had high levels of distrust. So there's blame to go around on all sides, but they have been, the Taliban has been brutal. There are other groups which also have not wanted either, felt like this is not a priority and didn't want it happening in their areas, or didn't want to allow outsiders to have any influence over their areas. And yeah, I mean, I interviewed people when I was in Pakistan. Sorry, like dogs are barking in the background there. Who, saw their workmates gunned down in front of them as they were simply trying to go door to door to provide this vaccine. So it's been very controversial, and the resistance to it at times has been really brutal. Someone else, Peter, did you swing?
Hey, I was going to ask you, what, not necessarily connected to polio, but when you're one of those crazy countries, I don't even mean Pakistan, because there's countries crazier than Pakistan, correct? But like sub-Saharan, how do reporters, you stay in a hotel and you get plenty of cash to use for food and transportation, or how do you do your day-to-day living when you're assigned to a crazy, uncontrolled place?
Well, let me tell you about the last trip that I did to Pakistan. I'm flying into Pakistan and I get into Doha, and our security people are like, do not leave Doha. You're just stay in Doha. We'll talk to you in a minute. Like, don't get on that flight. I'm like, all right. So, and then they come back and they're like, somebody was having these street protests. I was supposed to be flying into Karachi, and they were expecting these mass street protests. So I ended up having to spend an extra couple of days in Doha. Then they're like, you can go, but you have to just go to Islamabad, which is considered, relatively safe. So I fly into Islamabad. I then went up to Rawalpindi and out to Peshawar to sort of see some of these efforts that were basically, you sort of embed with these teams that are vaccinating, and they would go out by the side of the road and they actually had roadblocks set up and they were vaccinating people there, and you would be there for a little while, and then very quickly people would say, okay, and you, the white guy, you need to get moving now, like keep moving, just like don't stay in any one place too long. And it was the same. I eventually did get down to Karachi, but just the level of concern that you're going to get, basically, the system there is that if some street gang picks me up, an American citizen on a U.S. passport, they know who to sell me to up the chain. So you have this incredible value in the criminal market. And so it's just very important that you are not in one place for very long. So you go in, kind of try to get a scene of like what's happening. People are vaccinating kids on trains, but you can only be there for a few minutes and then you got to leave and try to get some photographs. It was Pakistan was very difficult to work in. I actually find Africa somewhat easier. The infrastructure is nowhere near what it is in Pakistan, but countries vary so dramatically. South Sudan is incredibly corrupt and it's very difficult to move around in. But I find Africa sort of an easier environment to work in. It's not as hostile as, say, Somalia or Pakistan. And I actually have never been to Afghanistan. So, and I'm not sure our security people would allow me to go to the areas of Afghanistan where I want to be covering this kind of stuff. So it's difficult. And it's one of the difficulties of actually keeping this story out there on the news is if it's that hard to report on it, you're just not going to get some of those frontline stories, which I had to say that I think those are the stories that really make people care about these issues. Like in Nigeria, I was in 2012, a reporter from our network and I went up to northeastern Nigeria, and we managed to track down one of the last kids to be paralyzed by polio in Nigeria. You could really see his family, and you could see his father carrying him because his legs didn't work. Those stories, I think, end up being much more impactful. And one of the, again, crazy things about polio is that it seems to penetrate into these areas that are so difficult for journalists to work in, and are so difficult for healthcare personnel to get in and do what they're trying to do. So it's a very interesting combination of social issues and I just feel like from a medical perspective, wiping out polio, it's easy. We know what to do to wipe it out from a medical and a disease perspective. All of this ends up coming down to these social and political complications that make it much more difficult.
Are there some lessons from polio that you think we need to make sure we apply in the COVID pandemic? Anything we need to watch out for?
I think, yeah, I think that the commitment for the long haul may end up being an issue with COVID as well. We might get into a situation with COVID where the vaccine doesn't lead to us just being able to wipe it out like SARS just kind of disappeared, right? We may end up with these pockets of infection that are popping up, and a need for a coordinated international response in order to contain it. So I think that very well could be an issue. And I think that polio has shown us the need for a lot of continued R&D, even when you think that things are getting right towards the end. The idea that they're creating a new type 2 polio vaccine, even though type 2 has been eradicated, that might just seem crazy, right? Like, why are they doing that? But this has turned out to be incredibly important now in trying to wipe out these vaccine-derived cases. So I think some of that that additional R&D that right on the surface might not at first seem like it's really worth the effort. I think that's something that polio teaches us, and yeah, is important. So there was another question from the chat. What stories from COVID aren't well known to the average person? I don't know. COVID has gotten so much attention. I think most of the I mean, I feel like a lot of it is out there. I do think there's a bit of over optimism on how quickly we are going to be able to get to herd immunity with the vaccine. Like, I just don't see this happening quickly. I mean, I have been saying next school year, next fall, I think we might have it, things really starting to move in the right direction. I think more and more people are kind of coming on board with like that scenario on COVID. I don't see like this winter, this spring. One of the things that polio shows is that it takes, these vaccination campaigns are not easy. The oral polio vaccine needs to be stored at -20 degrees centigrade when it's being moved around. Then you can sort of, once you get close to the end, I mean, hopefully the COVID vaccine will be relatively simple to administer, but especially if we're talking about injections, talking about multiple injections, there's the potential for things to get slowed down just with, you start giving multiple injections to millions of people. Some people are going to have an adverse reaction that might not even be an adverse reaction. They're just going to have some medical issue that hits them the day after that happens. Things have to get slowed down. So I think it's going to be a slow rollout, a much slower rollout than a lot of people. I mean, look, I'm hoping for a fast rollout too. I'm not advocating for that, but I think that the expectations on it at times are, as someone who's watched a lot of other vaccines get rolled out and around the world, I just can't see it happening really quickly. Yeah.
Jason, I have another question. This is a two-pronged question. First of all, I'm really curious, how did you get your start in broadcast journalism. But even more importantly, in today's really crazy multimedia world, where do you see radio going in our future? And what you do as a journalist, where do you see the future heading?
So I was an English major in college, one of those people who didn't, I was the type of English major that did not know what they wanted to do with their life, right? I was in college taking a lot of different courses, and I started interning. I worked at the college radio station and playing music and doing production stuff. And then I interned at KQED in San Francisco in their news department, and I just loved it. You know, they kind of gave you a tape recorder, sent you out to go talk to people. And that's really where I got my start in radio. I wasn't trained as necessarily a journalist. And yeah, that's how I got started. In terms of where radio is going, I actually think we're in a much better position than it might look. I think that we have seen huge drops in people listening to the radio, the actual radio during the COVID pandemic. Like, we get a huge portion of our audience from people stuck in their cars commuting to work, right? That we have capitalized on that for a long time. It's been a really great source of audience. But we're getting a lot of people shifting over to, asking Google in the morning to play NPR. People who are listening to particular podcasts that they have found that they really like, which might be some long form thing like Hidden Brain, or it might be Up First, which just is giving you a quick summary of the sort of big stories of the day. So I think that NPR is in quite a good position. It's tough with so much different places that people could go to get their news and information. But I think NPR has positioned itself well, and I think that we're in quite a good position, even as traditional radio listening is in decline. Somebody else had one in the
Canis, I think you had a question.
Yeah, not quite sure how to ask the question, but what I'm wondering about is, as a reporter, and I guess, what I'm seeing is, right, we have multiple countries, multiple universities, private companies working on a vaccine for COVID. And then we have political pressure as candidates are running for office now, and who comes up with one and how fast and which country gets it, and the espionage. My sort of question really is around, as a reporter, is like, how do you where is the story within all of that? And how do you approach trying to peel back so many layers of who actually has the best vaccine or who doesn't, or how much, like, is this going to be a movie we're going to see about all the espionage that happens after the fact? Like, I'm just kind of curious as a reporter how you get your head around this topic and how you would approach that.
Yeah, well, we've got people at NPR specifically focused on the vaccine race from a science perspective. We've got reporters specifically looking at it from the business perspective. So we've got some people on the business desk who are just looking at it from, what does this mean for the pharmaceutical companies and how is that playing out? We do pull in people from our security, from our sort of international security teams, looking at what are they seeing around intel and whatnot. A couple of months ago, the World Health Organization had 70 different vaccines that were headed towards phase 3 trials. So that had gotten through that initial phase of phase 1, phase 2 trials, and were headed towards phase 3 trials. Now it's down to about 45 that the World Health Organization is keeping tabs on. In addition, you've got China is working on several of them. So we are trying to look at who we think is going to be able to there's a winnowing down of that list of ones. There's the outliers, like Russia has got 2 vaccine candidates out there at the moment. We really aren't paying much attention to them. It's unclear what the quality is, but they might start trying to sell their vaccine in low-income countries before one is approved by the FDA or by somebody else. So we have to keep tabs on what Russia is doing, but we don't know anything really about what's in those vaccines. So from that perspective, we just sort of like, okay, we'll keep an eye on it. Then amongst the ones that we see coming up, part of what we are doing is just looking at, look, if this company gets there first, do they actually have the ability to move forward with it? Like Inovio didn't get funding under Warp Speed, but they've got a vaccine that's moving forward. They're one of the few that didn't get like a big grant, who actually look like they're in the running to potentially have a vaccine. We actually think there's not going to be one vaccine. There's going to be multiple vaccines. So we're looking at, like you look at Johnson & Johnson, you look at Pfizer, you look at Sanofi. These companies are capable of doing this. They're capable of the production that's going to be necessary to get the vaccine to market. So in even companies like Moderna, who we've barely heard about before, they've got enough backing now that a smaller company like that, also Novavax, another company that has actually never gotten anyone, I'm not sure whether they've gotten a single one of their products through FDA approval in like a decade, but they've gotten Warp Speed funding, and so if they can get their product out, there will be the money there to get it produced. So part of it is looking at what is viable, what are the candidates that are viable, because we can't be following 45 of them in this vaccine race. We have a daily meeting every morning, and what's happening with the vaccine race is a topic, I would say 4 days out of 5 on the morning call. Like, what do we think's happening? Getting suspension of or a pause in some of the trials that are happening on one vaccine. So it's something we're following very closely, and hopefully we'll be able to provide for our audience just reasonable guidance on what to expect as candidates get emergency use authorization from the FDA, which I think probably we could get a candidate by the end of the year. I think they could have that, and if once that happens, then you can start getting people vaccinated. So things are going to be moving. They're going to be moving quickly on some of that, but the full rollout, as I said earlier, I think it's going to take months and months.
Jason, if I could just ask a follow up, and Sally, sorry, I see your question there, so I'll cut you off. But I was just kind of curious, and the follow up to that is, as National Public Radio, what do you see, or what does the organization see your role or responsibility in the education or providing that information to the public? And as far as, and this is more maybe maybe you already have this policy already defined, I just don't know, but like, as you're sussing through and you evaluate this information, do you think you would take a position where you, as an organization, you say this is the one to trust, or these are the 5 to trust, or would you just really play it neutral and just present information and let people work on their own? I'm just not familiar with what NPR's position is on that.
Yeah, so we're not going to try to like pick a winner here or declare that this is the one to trust, unless somehow the Russian ones really sort of take off. Then we would issue caution that we know almost nothing about what happened in the development stage of this vaccine, these two vaccines that the Russians are saying that they're going to start selling, we are going to look to the FDA, the Food and Drug Administration, and there's a fairly clear process there. And so I think we would try to explain what an emergency use authorization from the FDA means, and that it hasn't won full approval yet, and try to explain that. But basically, we're going to leave, think something's not going to get FDA emergency use authorization unless these companies have presented to the FDA a reasonable amount of data and have done the phase 3 trials and shown that it's both working and that people aren't getting some horrible adverse reaction to it. So we will be guided by how it actually moves through the regulatory process, primarily from US regulators. I mean, the European medical authorities signed off on something quickly out of Europe, we would try to sort of analyze whether that makes sense. But it's probably going to be the FDA that is our guide on that. Yeah. Sally, did you have a question? In the chat. Oh, what's the status of work?
There's a large lab in Hamilton, Montana that has done some work on antibodies, and I wondered what you'd heard about what was going on at GlaxoSmithKline.
I am actually not. I mean, the work on antibodies is really quite fascinating on this current outbreak. I'm not completely. I don't follow GlaxoSmithKline that closely to say that the GlaxoSmithKline one is really interesting, but the idea overall of these use of monoclonal antibodies, like you had with President Trump got Regeneron, it's infusion, and there's a bunch of different companies that are working on this type of a therapy, which is fairly new. And what they're doing is that they're taking multiple antibodies, putting them into this infusion, which you get, it's a significant amount of fluid that goes into you in order to get these antibodies into your bloodstream. And they attack the virus at multiple fronts. And the idea is that it will, even if it doesn't do exactly what needs to be done to wipe out the virus, it will do enough that your body can take over from there and suppress the infection. So that basically just to keep the virus in the early stages, to keep the virus from being able to replicate. And it's fairly cutting edge stuff. And it seems to be one of the most promising treatments that's out there. It's not clear that it's going to work with people who have who show up later and the virus has really taken off in their bodies. But it's exciting stuff. It's exciting to see a new type of treatment for viral infections. Viral infections have been, we don't have all the time great. Sometimes you end up getting something that works like a silver bullet against the virus, but oftentimes viral infections are hard to come up with a medicine that treats it, and these antibody treatments are quite exciting. So, yes, the question about the UK program to infect volunteers. So what's this called? It's so I'll just explain. The UK has announced that they're planning to recruit volunteers. They're going to keep them in a hospital in London, I think. They're like not letting them out. They're going to infect them with the virus. And it's actually quite interesting. But we don't at this point have, as I said, like a silver bullet for dealing with COVID. Some people get it and takes off in their bodies and they die, or they end up on a ventilator. They have a really bad course, and we don't have medicines to stop that. So the idea of infecting people with it when we don't have a medicine to stop that is 100% going to stop the replication of that virus. Like say with malaria or something like that. Say maybe you want to do this experiment with malaria, you're going to infect people with malaria. Well, you know, if they start getting a bad dose of malaria, we've got the medicines to bring that down and basically cure them. We don't have that with this. So the idea that the UK is going to do this is, yeah, it's fairly controversial. At the same time, from a scientific perspective, it's really interesting because we want to know how much dose of this virus do you need to get infected? What is, yeah, is it just a tiny bit? Is it a lot? And that really isn't known because this is a virus we haven't seen a year ago. So there's a lot of interesting information that could come out of this study in the UK. I think they would have a hard time pulling that off in the US at the moment. Yeah, but it's interesting. It's definitely interesting, and they are going to be quarantining these people who they're infecting. So it sounds like they're going to at least have it under control. But you know, if one of these volunteers dies, I think there's going to be really a bit of a backlash against it, and I'm not sure that the knowledge that we are going to get is so dramatic that it's worth the risk. I mean, we already can sort of guess that the more virus you get exposed to, the more severe, and that's what it looks like at the moment, the more severe your disease is that you end up getting. But anyway, it looks like they're pushing forward with it. So, yeah.
Does anyone else have any questions for Jason? Let's see if I can. No, I had one more question, kind of wrapping back around to polio question. Yeah. Rotary International is obviously very supportive of the campaign. I think you often hear on the local level a little bit of polio fatigue from Rotarians. You know, it's been going on for decades at this point, and you know, but the problem is still out there and it still needs fixing. So how can we educate folks that it is important to continue and that our contributions are crucial, and why do we need to keep doing this? Do you have any help on that?
Yeah, because I think the answer lies in what if you stopped right now, right? What if you just were like, okay, we have been spending billions of dollars to try to wipe out this disease. So all of that would be lost. You would have a disease that shows its ability to come roaring back. It is capable of, you know, it moving through people who are asymptomatic, and it would quickly return in many parts of the world, and you would be having kids getting paralyzed again if you let up. I get it on the fatigue. I mean, it has been going on for a long time, and sometimes it seems like, you know what, it's Afghanistan and Pakistan's the big problem, and it's, you know, to some degree they're to blame for not actually dealing with it. But the problem is that you can't just leave it to Afghanistan and Pakistan. If you just think, oh, we're just going to leave it there, it will spread out of that area I would say, within a year, right? If you just eased up entirely, it would be spreading out outside that area. So as difficult as it is, and to sort of see it get dragged on and on, I kind of think that there isn't. I don't think just giving up is an option. I just don't think it's an option, because if the world stops trying to eradicate polio, you're going to have kids getting paralyzed. You can have kids dying at a level. I mean, I've seen some modeling. We're talking about in the hundreds of thousands range per year if that happened, and it doesn't have to happen that way. So that's my sort of overall pitch on why to keep going with this.
Well, I appreciate that. Thank you. And just to emphasize that point again with the club, that we're going to ask you to join the district's program called the Polio Plus Society that will support Polio Plus at the level of $100 a year. And that Rotary International has asked us at a minimum to contribute $42 per Rotarian to match the Gates Foundation grant this year. So this is important for our club and for Rotary as an organization as a whole. So we'll be getting back to our members on that front. So just before we say goodbye, Jason, just ask if anyone else has a question that we could finish up with, or just check my screen here. Well, I think it's been wonderful to have you. Thank you. Tom, do you have any final comments or thoughts?
Sorry. No, I just thank you very much, Jason. It's been great to have you. You've brought out some great points on polio and, of course, COVID, which is front and center on most of our minds. So thank you very much for giving your time today, and we look forward to hearing your continued work on NPR.
Okay, thank you. Thanks for inviting me. Take care.
Thank you very much.
Okay. Bye.
Have a great day.
You too.